All right, welcome back. Today we're going to talk a little bit about Chapter 2, Safe and Smart Physical Activity. The biggest thing we want to talk about is getting ready. Um, to get ready, a couple things that we need to talk about. I do have a link to Chapter 2 lessons, Fitness for Life, so you can check that out in the from the link there. I do also have that posted on the website itself, so make sure you check that out. The next thing that, probably the most important thing before you even get ready, is to answer what is called the PAR-Q. The PAR-Q is 7 questions. I'll give you an example. 7 questions that need to be asked before you do actually participate in activity. Those 7 questions are, has your doctor ever said that you have a heart condition? You should only do physical activity recommended by the doctor. Do you feel pain in your chest? In the past month, have you had chest pain when you are not doing physical activity? Um, do you lose balance because of dizziness? Or do you have bone or joint problems that could be made worse by changing your physical activity? Is your doctor currently prescribing drugs for blood pressure or heart condition? And do you know of any other reason you should not do physical activity? If you answer yes to any of those, you need to get yourself checked out by a doctor before you even move on and are allowed to participate. Hold on here. Why is this not working? There we go. Okay. Next thing I want to talk about is extreme weather conditions. Probably uh, one of the most important things that you need to think about before you go out into the extremities outside to actually work out. Hot and humid weather. Hyperthermia is an overheating process where your body temperature increases and it becomes too high to actually exercise. This happens during hot and humid weather. Um, there's a heat index chart I'll talk about. If you can take a look and see if it's 80 degrees and relative humidity is 40%, it's going to be 80 degrees. If that relative humidity, meaning there's 100% humidity in the air, it's going to feel like it's 87. Now, 80s in the 80s up to 88, not really a big deal until you get into that 100% humidity. Anytime it's in the orange or the red, you're talking very, very dangerous to be working out outside. Even in this extreme condition, you need to be careful when you are working out outside in the elements. When it is hot and humid, make sure you begin exercise gradually. Don't just jump in. Make sure you have a good warm-up. Increase the heart rate, increase the respiration rate, increase the perspiration. Drink water regularly. Water cools the body. It's great to cool the body. Take more water in, more sweat. Sweat is a natural, sweat evaporates and cools the body naturally. Make sure you wear proper clothing, lighter colors, not dark. Lighter colors and a porous fabric that wicks the sweat away from the body is important to use. And lastly, make sure you rest frequently. You've got to take breaks when it's very hot because that allows the body to adapt to that heat and recover from that heat and cool down a little bit when you are working out. Some heat-related conditions, heat cramps, heat exhaustion, and heat stroke. 2 of these are very, very, very dangerous and can actually cause a lot of harm. The other one's just really discomforting, and that is heat cramps. Heat cramps, muscle cramps caused by excessive exposure to heat and low consumption of water. I've experienced these. They're just kind of a pain, a nuisance. But if you don't get them taken care of, they can lead to some further damage. So if you are experiencing muscle cramps, kind of slow your activity down or stop your activity altogether. Make sure you consume some water at that point or some other solution, water solution, Gatorade, that type of thing. Excuse me. Heat exhaustion caused by excessive exposure to heat usually is accompanied by paleness, cold, clammy skin, profuse sweating, weakness and tiredness, some nausea, dizziness, muscle cramps, and possible vomiting, or fainting. Body temperature is normal or just above normal. I have experienced this, not very fun. Thought I was going to throw up. Not good. Got myself out of the sun and the heat, hung out in the shade, and slowly drank some water. Didn't down it real quick, but slowly drank some water. Eventually, I got myself back to where I could participate and keep moving. So, heat exhaustion can be dangerous to experience. And probably the most dangerous one is heat stroke. It's caused by excessive exposure to heat. characterized by high body temperature. Your temperature could get up to 106, and that is not good. Hot, dry, flushed skin, rapid pulse, lack of sweating, so you're not sweating at this point. So that's the body saying, hey, you need to stop right now. Dizziness or unconsciousness. This is a serious condition, can result in death or requires prompt medical attention. If you ever experience any of these symptoms, you need to stop what you're doing and get yourself to a medical facility as soon as possible. That leads us into extreme cold and wind. As we're experiencing right now, hasn't been that big of a winter for us, but one of the things that you need to do is dress properly, and that's layers, 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 layers. The more layers you have, the more air that is trapped inside, creating a warmer air as an insulator. So it actually keeps you warmer in the long run. So use layers. Some symptoms of frostbite, and this can happen to just about anyone. It actually happened to my uncle. He was in a car accident and lost his fingers on his right hand and his thumb. Just kind of had a stump for a while, and we called it the hook. But anyways, skin becomes white or grayish and yellow and looks glossy. You have pain sometimes felt early but subsides later, and feelings often lost, and then there's no pain is felt. So that's kind of a bad thing when that happens. Blisters may appear, and the affected area feels intensely cold. So that's not good. Some things that you need to do in order to get your body ready for warm up again, or for activity, is warm up. We talked about this last week. But you need to increase your heart rate, perspiration rate, and your respiration rate. So increase your heartbeat, increase your sweating, and increase your breathing. Cool down, exact same opposite. Decrease the heart rate, decrease the sweating, and decrease the respiration rate. Normally when we do a warm-up, we do a certain progressive set of exercises to the activity, and the cool down, we want to work those exercises backwards down to the cool down to bring yourself back down to a normal resting, not close to resting heart rate, respiration rate, and perspiration rate. Some common injuries that can occur, we need to discuss a little bit about those so you have an idea of what you are looking for. One is an overuse injury, which occur when movement is related so much that wear and tear occur on the body. This can happen over one workout, such as a blister, or over a longer period of time, such as stress fractures. We'll talk a little bit more about that later. Side stitch. Pain is in the side of the lower abdomen. Usually happens in running activities. A couple things that you can do to that to get rid of that. Just kind of push in and up. It's usually a cramp in the diaphragm itself. And a microtrauma. Small injury usually happens at the cellular level in the body. These can go unnoticed for years. That's actually what a stress fracture is. It happens, real small trauma happening over and over and over and over and over. You also have shin splints. It's kind of a micro trauma. You don't think anything of it. You don't think anything of it. It starts, you have a little discomfort, and then it continues on to something worse. So make sure you get those taken care of and take care of those. Preventing some of these injuries, a couple things that you can do. We need to discuss some things that tie them together first. If you take a look at ligaments, ligaments are connective tissue that holds the bone together with the bone. So a ligament holds bone to bone together. All right. A tendon attaches the bone and the muscles together. So muscles, tendon, and then to the bone. So these are very important because bones are levers that move the body, and the muscles move the bones, creating force. So these forces can cause problems if proper technique is not used. And it is important to follow that proper technique so you don't get injured. Biomechanics are the principles of forces exerted on the body. So you are using biomechanics when you are moving through your range of motion and creating some simple forces on those motions. So physics, a lot of physics involved in that regard. Probably the most important thing that you can think about when you look at your bones and muscles and biomechanics is never force joints to move in ways which they're not made to move. Can really do some big damage. to your joint and to the muscle and to the bone. Muscle balance kind of leads us into muscle balance, something that you need to look at when muscles always work in pairs or opposition. And examples are biceps and triceps, chest and back, hamstrings, quads, glutes, and hip flexors. Now, if all I do is go into the weight room and all I do is biceps, my biceps are going to get real big and my triceps are not going to be very strong. Therefore, I'm creating a muscle imbalance. When I have that muscle imbalance, mechanically, I'm not going to be able to push as much as I can when I pull, and that is going to create some stress on my elbow joint. So that's what you need to take a look at. Here I have a picture of a muscle-bound dog. You know, that dog is got some genetic flaws, but muscle-bound dogs, you see them in people too. All they want to do is their upper body and not do their legs. Well, that creates a muscle imbalance, and then they're putting themselves at risk biomechanically to do some things improperly and get themselves hurt. If you do get hurt, injury treatment, the Rice formula. What is the Rice formula? It's not the little white stuff or wild black rice that you eat. It is a formula to treat injuries. The R stands for rest. Immobilize the body part for 1 to 3 days. You want to somehow put it in some sort of a structure where it will not move for 1 to 3 days. The body naturally does this when it swells up, but we're going to try to limit that swelling a little bit with some ice 3 to 5 times a day, at least for an hour in between. So when you do this, you can ice for about 15 to 20 minutes, 3 to 5 times a day with an hour in between each time that you do ice. That will bring the swelling down, and that's what we're trying to do. Compression also helps limit the swelling. You want to wrap that injured area to keep the swelling out and also to give it some immobilization with the rest. So compression kind of works in 2 ways. And the last one, elevation. Keep the body part above the heart to decrease that swelling. If it's below the heart is going to pump blood to that area. If it's above the heart, it's going to have a harder time to pump blood to the area, and that's what we want to do. We want to eliminate that blood going in there to create that swelling. So rest, ice, compression, elevation, Rice. A couple things that you want to avoid, 2 actions you want to avoid. We talk about biomechanics. Hyperflexion and hyperextension. Hyperflexion is where the joint is bent too far, and hyperextension is where it's bent the other way, too close. Hyperflexion is too close, hyperextension is too far away. 2 pictures you can see here. We have hyperflexion of the knee, right, and that's putting a lot of undue stress right there, and you have potential to really actually rip the quad. Hyperextension on the gentleman, you can see you get hyperextension of the elbow. That the elbow actually goes up instead of staying in a straight line, and that puts a lot of undue stress on that elbow. So these are 2 actions that you want to avoid: hyperextension and hyperflexion. Hopefully you've learned something from this. There are some ancillary items on the website for you to continue to learn and help ingrain some of this information. We'll talk about this on Tuesday also in the classroom. Thanks. Have a great day.